Hey, Dr. New here. I wanted to answer your question you sent me by email in video format because I think it'll be easier than me writing an entire novel. Although this video might be 4 hours long by the time I'm done rambling. So I'm not sure which is easier, but let's try it this way. So you emailed me a question, and I'll paraphrase here. You said, "What are your thoughts on using Wegovy in pill form? I'm dying to lose weight, and the exercise and diet are just not working fast enough. Thanks." Well, man, thoughts, so many thoughts. This is probably the most important and common topic that I answer these days, especially in the last couple of months about using these new oral options for weight loss, Wegovy or the GLP-1 meds. But I first want to just share my thoughts in general about GLP-1s. The option to do one orally won't really change this much other than some people are more comfortable using oral meds and they might be slightly less effective than the injectables. But I think that's a minor distinction or preference in terms of injectable versus oral. And when we compare to the new oral Wegovy option. But when we look big picture at using GLP-1 agonist medications, in your situation, a guy in his 40s who is struggling to lose weight and has for a while, who also has evidence of metabolic syndrome or, quote, prediabetes or insulin resistance. I would love to just say these medicines are awesome and effective and safe. And yes, do it and all your dreams will come true. Or I would love to make a video that say these medicines suck and they're terrible and don't take it. But unfortunately, this is not that simple. And there are many considerations when deciding whether to take a medication like this to help your weight and metabolic syndrome. So by far, this class of medication is the most potent, powerful medications we have ever had in terms of weight loss. In fact, they're really the only ones that long-term have shown to do that. And so in that respect, they are amazing. And that's why so many people all around the world now are taking them for that purpose. So yeah, in terms of weight loss, it's hard to argue that 90% of people lose a significant amount of weight. But I think the first thing I always ask patients is, do you plan on using them long-term, or would you be willing to use them long-term? And by long-term, I mean indefinitely, forever. And that might seem like, hey, well, maybe I'm not that committed. Let's not go there. Let's see how it goes. The reason I asked that question up front is because all of the studies and my experience have shown that if people do lose weight on these medications, and the vast majority of people do, and they stop them, that they will regain that weight relatively quickly. Within 6 to 12 months, definitely by 18 months, 80-90% of people or greater will regain that weight. And that's unfortunate. And I think it's not just that, but it's what it potentially means for a person's health long term. And I've said this for a long time, way before we even had GLP-1 medications, that we would rather a person be slightly moderately overweight and stable than lose a ton of weight and regain it, lose a ton of weight and regain it. Kind of the roller coaster or yo-yo dieting effect that we have seen. And that's because there's a lot of research showing that rapid weight loss and regain, is actually probably worse for our health than just staying moderately overweight. And so I'm not saying that we should accept that or we should tell people just to learn to cope with it, because I don't think that's ideal or optimum. But the reason that this is likely the case, and I believe will also be proven out to be true with these medications, is because when a person loses a lot of weight, let's say they weigh 100 pounds too much, when they lose weight, they are going to lose some portion of fat, which is good. We want people to lose body fat, and they're going to lose some portion of muscle. And that's inevitable when you lose a lot of weight. And that's not inherently bad and would happen with or without these medications. But if a person goes through that process, loses 100 pounds, and let's say they stay the same percentage body fat over that 100 pounds. So they start off at, let's say, 30% body fat, and they end up at 30% body fat, but they weigh less. I think in a net, that's a good thing and that's positive. And I think that the research is now showing that GLP-1 medications don't necessarily cause people to lose more muscle than if we compared it to another treatment option like a strict diet. So this is my thoughts on this are not just because of the GLP-1. It's not like they have some nasty side effect. It's just that they're way more effective than diet and exercise for most people. And so if that happens, that's great. Like if a person remains, the same leanness as they were, 100 pounds lighter, they're probably in most cases better off. However, the problem becomes that if they regain that weight, I would say there's a great chance that they are going to disproportionately gain more fat than muscle. It's just much, much easier to gain fat, unfortunately, than it is muscle. And so if you took that cycle, person losing a lot of weight and then regaining that weight, and did that over and over, my experience and some evidence now is showing that health outcomes might actually be worse in some respects, especially as people get into their older years. Because what we are doing is creating a person who is low in muscle mass, perhaps low in bone mass. And even if they can maintain a lower weight, they're going to end up being, quote, skinny fat. And they may have a lot of the same metabolic health problems like type 2 diabetes. And so that is not the fault of GLP-1 medications. I think it's just because they're so darn effective that if they are used in that way intermittently to lose weight and then they stop the medication, this phenomenon is somewhat likely to happen, I believe. We don't have good research on this. All the research is like, hey, you take it for 12 weeks or a year or two. And so until we know that for sure, we're kind of going off of our experience. But it makes sense to me that we shouldn't tell people that these are temporary ways to lose medication. Although I know in the real world that is happening, unfortunately. So it's a big commitment. All that to say, this is a big commitment. This isn't something that will, help you lose a certain number of pounds and then everything will be hunky dory. Again, a guy in his mid 40s, you have a good number of decades left in you. So, from my perspective, if a person decides to do this, I tell them it's a forever pill, or injection if you do that route, and not something temporary. So, that's my biggest issue with these medications. We do know that there's other potential risks or problems with them. The first one would be side effects. Relatively common to get some degree of side effects. Nausea is to some extent there in most people, but we can manage that typically with lower doses and then increasing them slowly over time. But there are the people who get more severe side effects, like I've seen some constipation and some other things like gastroparesis, which is kind of a paralysis of the stomach, usually reversible. But those are real considerations with these meds. But really, in most people's journey with using these medications, cost by far is what becomes a problem. So even though people are pretty desperate, as you said, dying, in fact, to lose weight, they're willing to pay that money in the beginning, and then they lose some weight, and 6 to 12 months pass, and they've kind of gotten out of their goal, and then that $300 a month or $500 a month or whatever it ends up being starts looking not so good anymore. And so I think that those are the things that might impede a person, even if they intend to take the medicine forever. That the future is hard because we sometimes have reasons why we just can't continue something. Obviously, some people's finances just change, right? And so that's kind of my bird's eye view of using these medications. But if you do want to consider them, given all that information, I do think they could be helpful in your case. At bare minimum, I would recommend doing a body composition test before you start one, so we can get a fat measurement and muscle measurement, and then probably repeating that every 3 months or so, or more frequently if you're losing weight very quickly. And then obviously we'd have to continue monitoring things like labs and waist circumference in your weight, to make sure that you're actually not just losing weight, but getting healthier and losing the right type of tissue. So I hope that provides some more context to this. I wish I could make like a TikTok 17-second video, but hey, that's not the type of doctor I am. So hopefully this helps you or anyone else who has questions about considering these type of medications to help them lose weight.